We'll be looking at a quick possible oral question that it could be asked for iron deficiency anemia. Okay, and in the clinical classes, most of the consultants and the doctors, they are basically looking at how you can reason out differential diagnosis. Okay, and what is differential diagnosis? Differential diagnosis are other medical conditions that can cause like half of the symptoms you said this medical condition can cause. Do you understand? Because symptoms are few symptoms are restricted to some medical conditions though. All right. So most medical conditions they have these general symptoms that other medical conditions can also cause, right? So that's a different differential diagnosis for each medical condition. So for iron deficiency anemia, let's look at the possible differential diagnosis for this medical condition. Okay, so differential diagnosis for iron deficiency anemia. And let's refresh our memory. What is iron deficiency anemia? Anemia is basically the reduction in the blood capacity to carry oxygen. Okay, and this type of anemia is caused by what? Deficiency in iron levels in the body. Do you understand? And what is the use of iron in the body? Iron is a component of hemoglobin, and hemoglobin is what transports oxygen. Do you understand? That's a refreshment. I'm moving straight up to the differential diagnosis for iron deficiency anemia. We say that differential diagnosis is a medical term that refers to the process of identifying and ruling out possible causes of a patient's symptoms or condition. Okay, so differential diagnosis, you don't really just only mention them. All right, you are basically looking at, okay, this other medical condition can cause weakness and fatigue, just like iron deficiency anemia. But this weakness and fatigue was not caused by that medical condition, it was caused by iron deficiency anemia, and you give your reasons. Do you understand? So, possible medical conditions that can cause symptoms like the one of iron deficiency anemia is what? Thalassemia. What is thalassemia? Thalassemia is defect in hemoglobin. Do you understand? But you know that hemoglobin has globulin and iron. Okay, so iron deficiency anemia is defect in what? Iron in the hemoglobin, while thalassemia is defect in the globulins. Do you understand? So each of these conditions will result in deficiency in iron oxygen carrying capacity. Do you understand? Then we have sideroblastic anemia, can also give off symptoms just like the ones of iron deficiency anemia. Then anemia of chronic diseases can also give off symptoms like that of uh, iron deficiency anemia. But this anemia of chronic disease is from underlying medical conditions, right? You have other chronic diseases in your body that are basically causing the the oxygen carrying capacity of blood to decrease. Okay, then lead poisoning too. If you are poisoned with lead, which is a heavy metal, you also develop these symptoms that are like the symptoms of um, iron deficiency anemia. Okay, so this is your normal blood film. You can see the red blood cells, you can see the white blood cells, and you can see the platelets. They are in sufficient amount. Then thalassemia, you see that they are malformed blood cells, right? So the difference between iron deficiency anemia and thalassemia is what? This one, the red blood cells are malformed. While in iron deficiency anemia, the red blood cells are small. Do you understand? So you also know the differential diagnosis, that's the medical conditions that can cause similar symptoms, and you also try to know the differences. Okay, so they ask you, what is the differential diagnosis say? This is it. Okay, so why is it that this disease is not caused by this, right? So you must say the differences, right? So this is sideroblasts, and you can see that the red blood cells are nucleated. Okay, so normally a matured red blood cell should not be nucleated. All right, so that's the difference between sideroblast anemia and what? Iron deficiency anemia. Okay, so bone marrow smear, Prussian blue stain for iron. All right, basically that's how to observe it. Okay, so toxic effect of lead poisoning. What is the one that is related to anemia? Okay, anemia. Okay, so lead poisoning too can result to symptoms that are like the ones of what? Iron deficiency anemia. All right, so guys, that's it about the various differential diagnoses for iron deficiency anemia. See you guys in the next one. Bye for now.